EMS can be a hard job. It can even be a harder profession for those of us who have decided to stay with it for a long period of time. If you talk to some EMTs and paramedics, they probably wouldn't even say that it was a decision. They may have come into the field and after a while they just feel stuck in it. One of the problems with some of the new EMS employees that are coming in, some of the new EMTs and paramedics, are that we don't think they can properly understand some of the challenges that are hidden in EMS. Not all the challenges that happen to paramedics and EMTs in the field can be easily described in a textbook or in a discussion or in a lecture. So today we're going to talk a little bit about those challenges, but we're also going to go over some of the benefits that you get from EMS. This is going to be our final full podcast for this season. We're going to take a little break until the end of November. We are going to release one other podcast after this, but that podcast is going to be more of just a question and answer that we're developing. Before we get into that, however, we are going to hear from a person who went through a very traumatic event and some of the challenges that he's had to face after going through something like that. We thank you for joining us here at OurEMSsite.com, and we hope you enjoy. Here we go.
Thank you for joining us here at our EMS site. The purpose of this website is to support all EMS personnel. Our overall goal is to provide you with some input, tips, or ideas that you can begin to apply in your field or training. Please don't forget to submit your questions, comments, or concerns. Stay safe out there, and remember, better life is our mission.
Thank you for talking to us for a little bit about your mom today. We're here with Robert, and I guess the first thing we would like to get into is, was your mom sick before the event?
No, man, she was not sick. Never been diagnosed with anything. I maybe now, if you look back at everything that happened, you can kind of like see the signs where I'm sure she had hypertension. Every now and then she would wake up with the little vessels in her eye kind of pop, you know. And she would always, every now and then she would say she would have headaches that just she couldn't get rid of. But as far as like her being sick, no, she exercised on a daily basis.
Really?
She ate good.
What kind of exercise would she do?
She would walk at the track. She would walk like 2 or 3 miles every night. Every evening, like around 6 or 7 evenings, she would walk 2 or 3 miles every evening. She didn't drink Cokes. She drank water. We hardly ever ate out. So, she was never really diagnosed with anything when everything happened.
On the day that everything happened, what were you guys doing? Were you just at home or?
When let me start before everything happened. It all started, she took my grandmother to Valley Baptist, that hospital, to have, she was being pre-registered for a procedure she was going to have done. My grandmother was going to have it done. So when my mom was in the waiting room, she said she felt like a lightning bolt strike her in the back of the head. Like it was just a sudden boom, like a pop, she said. And she got dizzy, and then she woke up in a hospital bed. That's all she remembers. And then they took her in. They did a scan on her, and that's when they found out she had an aneurysm less than a centimeter wide or something like that. And then we brought her. Actually, you know what? So they diagnosed her with the aneurysm. They pretty much told us there's nothing else they can do for us because we don't have insurance. So we kind of fell between we can't afford insurance because we didn't make enough to afford. Health insurance is expensive, and we made too much to qualify for any type of assistance. So they kind of just sent her home and told her good luck with everything. It was almost like a ticking time bomb. So after she got home, it was 2 weeks later when the aneurysm ruptured. But she was just here. She was laying down in bed. And, I had just gotten home. I was at TSTC doing something at school. I got home. I was in my bedroom. And then my older brother, they were watching a movie together in the living room. She got up to use the phone, went to the bedroom for at least, man, I'm gonna say max 5 minutes, and then he followed her over there because he was gonna go lay down in her bed, I guess, with her. And then that's when everything pretty much happened.
So he follows her, and then what?
So he follows her to the room, and she was laying like face down on the bed. So he lays down next to her, and I guess he was like talking to her, but she wasn't answering. And then I was in my bedroom, and then I hear him screaming, like an ugly scream, saying, Bobby, come here. Something happened to Mom. So I get up, and I was like, what? And he goes, she's like out of it, man. So I'm like, okay. So when I lift her over, I mean, you could, she wasn't breathing. She did have some cyanosis already to her mouth. So we picked her up, put her on the floor, and we started doing CPR. Or I started doing CPR. And my brother, he was talking to 911. And even though the ambulance was, man, I'm going to say, like 6 miles away from my house, it seemed like an eternity, man. Like, seemed like it took forever for them to get here. But yeah, I just started doing CPR. The ambulance got here. They put her on the stretcher, put her in the ambulance. And I remember standing at the edge of the door, and I saw the monitor, and yeah, she was a.
So, just to clarify, if people don't know what cyanosis is, what did you mean by cyanosis?
She just had blue to the lips. She was blue, blue to her lips. It was just, she hadn't been breathing, you could tell, for a while.
And then when you see the monitor, there all you're seeing is a line.
Yeah, I just see a line. The paramedic in the truck kind of explains to us what's going on. Mm-hmm. So they continue to work on her, and then my dad was working at the time, and then he shows up, and he's just like hysterical because and then I remember it's kind of hard to remember everything, I guess. I don't know, I'm not gonna say my mind blocks it out, right? But I remember seeing the helicopter flying by. It landed in a empty lot or a field down the road. They flew her out. We drove to the hospital, and at the hospital they tell us, hey, en route they got a pulse back, but her blood pressure is like super high. It's like, it's crazy high. So we're like, okay. So we get into the room, and she's already in there. They had already done a CT scan on her, and then one of the charge nurses comes up to me, and he's kind of explained to me what's going on. And I mean, she had a stroke. The aneurysm did rupture, and it was like a massive stroke. He said there's blood everywhere. So my dad was there. The neurologist came and talked to us. The same neurologist that actually diagnosed her with the aneurysm came inside the ER, talked to us. And it got kind of like hectic in there, I guess, because he kind of like, there's like a 1% chance this aneurysm is going to rupture, and he kind of sent us home like that, So my dad kind of like got into it with him a little bit, and I'm sure it was just based on emotions, and they kind of gave us the option, like, look, we can do this procedure. I think it's kind of where they cut the skull open to relieve any type of pressure and all this other stuff. But I think the ER doctor was the one that was telling us that she's not reacting like to anything, right? So they kind of gave us the option to disconnect her from the ventilator and all the other stuff, or proceed with any type of procedure. So my dad brought me and my brothers in, and he kind of like talked to us about everything. What do you think we should do? What's crazy about this too was that I remember when my mom came back from the hospital, she was telling us, if anything happens to me, I don't want to be that person who's in a nursing home where people have to feed me and clean me. And, we always just kept telling her, like, shut up, Mom, be quiet. Why are you thinking like that? And then when all this happened, we kind of just fell back on, like, man, Mom didn't want to live a life like that. So we all just came up with the decision just to take her off the ventilator. And sure enough, when they took her off the ventilator, man, she didn't react to nothing. She wasn't breathing on her own. It was crazy because her heart did take a while to stop. Like, we saw it all, and I still remember the time. It was like 8:24 in the evening, and it was like 4:12 in the afternoon when everything happened. I remember looking at the clock. So,
and that was at the ER.
Yeah, everything happened at the ER. So,
how old were you then? How long ago was this?
Okay, I'm 30. I'm going on 10 years, so I was 21 years old. Yeah, this 2019 will be 10 years already.
So you were 21. You were already in EMS?
Yes, I had just been in EMS for 1 year. I started when I was 20. But going to school and stuff, I guess it would be 18, 3 years now, because I started when I was 18.
And you, as an EMT, did you see anything that could have been done better?
Now, okay, not the better part, but now that, I guess just because of the experience and everything now that I've seen, man, there's so many signs that I've seen, not just with what we could have done better with my mom during the call, but what we could have prevented prior to all this, like the blood vessels in her eye, the headaches. Man, these are all signs of, someone with high blood pressure. So I'm sure, and this has been years she had been dealing with this. So I'm sure, if we would have just probably pushed her to go to the doctor, she never went to the doctor, And you see that a lot down here too. But if we would have pushed her maybe to go see a doctor, they could have diagnosed her with hypertension, put her on some meds to help stabilize. So I'm sure she was running with, her blood pressure was high probably for years and years and years.
Did she, after she was diagnosed with the aneurysm and they let her out, did they put her on meds or not?
They put her on medication for high blood pressure. They kind of cut her off her salt, no sodium. So, but the medication they were giving her for hypertension, I can't remember what it was, right? But it made her feel real nasty. I remember she was telling us that, like, real dizzy. She would have a lot of dizzy spells. Anytime she would try to bend down to get something, she felt like she wanted to pass out, she said. So she was taking them, but I know she had wanted to speak to the physician to try to get something, get something different.
But from the EMS standpoint, nothing could have been changed. Nothing that you think would have made a big difference in the outcome.
No, because now that I see stuff like this, it's like I feel, or I'm not gonna say I feel, but like my mentality is you can do anything you want to try to revive a patient. Medications, all these interventions. I just feel like when it's your time to go, it's your time to go, and there's really not much.
So you could follow the textbook,
man.
Do
meds,
everything.
Everything.
Because they flew her out. I'm taking it because of the transport time.
I'm gonna say from my house to Valley Baptist, it's almost 25 minutes. So it's a good transport time.
So while they were working her in the ambulance, they launched the chopper.
Yes.
The helicopter picked her up. And then they did get her a pulse somewhere.
Somewhere from when they left my house to that lot down the road. Because we didn't follow them over there because the fire department and the cops had already kind of blocked off the road. Okay. So from that point to where the helicopter left and got to the hospital, they had gotten a pulse back. Okay. And I think I've seen it before on other calls, right? About the whole, when you initiate CPR, man, like it's a good chance of, and I do believe in that too. That is a good, and I'm going to say my mom was breathing for, maybe max 5 minutes because my brother went with her pretty quick. And we started CPR right away, so.
And well, just the fact that you got a pulse back at all shows that, CPR did do its part of it, of keeping at least the heart viable, even though the rest of the system was failing.
Yep.
And so how long have you been in EMS now?
I'm going on 11 years in a few months already. 11 years now.
Well, we appreciate your time. Thank you for talking to us a little bit about your experience.
Not a problem.
EMS is not for everyone. This should not be a big surprise to anybody that is working in EMS or anybody that knows about EMS. And this is true for any number of jobs. Not everyone is cut out to be a firefighter. Not everyone is cut out to be a police officer, soldier, even people in the financial district. But EMS has some hidden challenges that might not be initially apparent. Yes, we all know while we're going through school that you have to be ready to function at a moment's notice in an emergency. But a lot of times they don't put a lot of emphasis to the fact that sometimes the challenge is going to be just waking up, just being able to come out of a nap or a sleeping, and you're going to have to be able to function correctly in an emergency. This might seem easy initially. Well, I mean, we just get the tone out, we get sent, we can function. But for anybody who's ever woken up in the middle of the night or woken up at 2, 3 in the morning and had something going on around them, you know that this could be a challenge, especially if it continues to happen on every shift, especially if it continues to happen for long periods of time. This can wear on you. This can deter you from making some decisions that you have to be ready for. And that's one of the things that you can't quite explain it to people when they're going through school. You can't quite explain it through a textbook or even a video or this podcast. It's just something that you're going to have to experience. You're going to have to become a part of EMS. And then when you respond to these calls at 2, 3 in the morning, after having a full day and after being asleep for maybe a couple of hours, you're going to have to learn how to get yourself prepared for those emergencies, be able to function and not put yourself at risk for liability, but more importantly, not put the patient at risk for injury or possibility of further trauma due to an emergency. All of us in EMS, as we were going through our education, as we were getting our training, we all are told that death is going to be a part of our profession. Death is around us, especially if you're working a busy 911 system, a busy emergency system. What can't quite be explained, and this was something that was submitted on Tumblr, was that sometimes it's not even the death itself that takes a big toll on you, but it's letting the loved ones know that the family member has died. It's letting the parents, the grandparents know that their child has died. It's telling the spouse that there's nothing you can do because the patient has been dead for a prolonged period of time. And that isn't something that you can be trained for. It isn't something that you can read in a book and completely understand what that entails. It will hit you in a different way. We all know that the death of a child is traumatic. We all understand that it will take its toll on you. But seeing some of those looks on the parents' faces when they begin to accept that their child has gone, that their child is dead, well, that's a toll that you can't learn from other than experiencing it. I remember there was a crew that had to work a 12-year-old, a sudden cardiac arrest in front of the parents. The 12-year-old walked out. I believe they were having like a movie night, and then collapsed in front of the family. The medics got there. There was 2 paramedics on the unit. They worked the patient. They brought her into the ER. The patient did not survive. The patient died. They did everything textbook. They were able to get on scene quickly. They were able to begin CPR. CPR was started prior to their arrival. They were able to administer all the medications that they needed to. They intubated quickly. There was no real delay on scene. They transported quickly to the ER. I was not a part of that crew. I was there at the ER, and when I saw them going in, there was a lot of commotion. Obviously, everybody wants to help, especially because it's a child. I went into the back of their unit and I just started to clean up a little bit. I thought there was enough hands on deck. I was okay. I was in the back of the unit when the medics came back out with their stretcher, their equipment. They had already wiped everything down inside the ER. They were just moving the stretcher back into the ambulance. And that little girl's parents were in the bay. And they came up to the medics. And they just had a look on them of just complete devastation. And they thanked the medics. They thanked the medics for everything they did. They thanked them for trying. And as they were leaving, the little girl's mom turned to the female paramedic and told her, "You must have you have the worst job in the world." Because she saw how much this paramedic tried. She saw how much this paramedic wanted to change the outcome. She did everything she could. And you can't quite understand what that means to do everything you're supposed to do. Do it according to the book. Do it according to the latest scientific studies that have been done, do it according to the latest protocols that you are allowed to do, and you are still going to fail. There are still going to be cases where everything is going to go sideways. Everything is going to go wrong. And it has nothing to do with what you as a medic, as an EMS personnel, as an EMT or paramedic are doing. It's just that patient is not going to survive. That's not something that you can just pick up out of a book. It's impossible to understand what that means. And it's impossible for me to try to tell you what that means. I'm not trying to do that. I'm just trying to convey that is a particular challenge that once you're in EMS, you will come to know that you, just like in the interview that you heard, everything was done correctly. Everything was done to a point that you would think this should be a patient that survives, and that patient will not survive. When it comes to family, another challenge that you can't really understand is there are going to be a lot of times that because you are in EMS, you are going to miss out on your family. And that's its own special kind of payment that you have to do to EMS. A lot of people believe coming into EMS that it's going to be okay. Your family, your spouse, your kids, they're going to understand. I mean, you're going into an EMS system. You're going in for an emergency. You are the one that's going to be holding that line if certain situations come into your area, a hurricane or even flooding, things like that. But it's still going to take its toll, and it's hard to overestimate how much that could cause problems in your relationships. It's hard because a lot of it depends on the other person, right? And that is something that you and EMS are going to have to acknowledge. You're going to have to understand that there are going to be times when you're going to miss certain holidays. You're going to miss certain anniversaries, certain vacations that everybody's taking, and you're going to be at work. And it's just something that I know we talk about it when we're going through school. I know it's said, and even when people are doing their write-outs, I know I bring it up, like, don't make plans right after your shift because you never know when you're going to get that late call, and now you're completely destroyed everything for everyone. But at the same time, it's something that you don't understand until it starts happening to you, until you start getting scheduled for that Christmas Day or Christmas Eve, depending on when you celebrate, or New Year's Eve or Thanksgiving, and those things take their toll, especially on your family when, well, they want you around, they want you to be a part of it. And because of this field, we don't take holidays off all the time. Sometimes we need to come in. There's certain systems like the one I'm currently in, where if a hurricane comes into your area, you get activated. They'll give you time to set things up for your family. But then during that hurricane, during that event, well, you're going to be trying to assist anybody that needs you, whereas your family is going to have to be in another location, hopefully in a safe location, but regardless, they're going to have to be in another location fending for themselves. When we started this podcast, when we started this specific episode, we wanted to talk a little bit about some of those hidden challenges that are in EMS. We also wanted to let you know that there are a lot of benefits. Is it hard work being an EMT or a paramedic? Of course. Anybody that's in an emergency system, anybody that has been in the field for a long time, they can tell you that it's going to be challenging. Are there going to be moments that you're going to think about maybe not coming back? The answer is yes. Have I ever wanted to maybe completely change profession? Have I ever wanted to walk away from being a paramedic? And the answer is yes. It has happened. It's happened after some of these challenges that we talked about today. It's happened after maybe those long shifts where you were having the types of patients that you just don't want to deal with on a regular, everyday basis. And there are going to be those moments. But there are also a lot of moments that are going to be bringing you back. There are a lot of moments that are going to give you the strength to keep going when you're having those bad days. You're going to be able to remember them. You're going to be able to remember the saves that you've had, the lives that you've impacted. And not anybody can say that nowadays. You can't just say, oh yeah, I've saved a life. Whereas an EMT and a paramedic, you can. A lot of times you have done great benefits to a person's life. Not only to them, but also to their family. There's a story recently that a paramedic was telling me where he was walking out of a Subway, and a person came up to him and said, oh, you already bought your sandwich? And that medic was was explaining to him that yes, he had already purchased this, and the man wanted to buy him the meal because he remembered him. He didn't remember him from a very traumatic incident. He didn't remember him from a very severe disease. That man remembered him because that paramedic, when he arrived on scene, that man thought his daughter was dying. That man thought his daughter had gone into cardiac arrest. And when the paramedic arrived, the paramedic let them know, this is a seizure. She's having a seizure, a febrile seizure. And the paramedic was able to calm them down and to take care of the situation, explain to them what was happening, and more importantly, was being professional, was being courteous to them. And that made a huge impact in that man. That man didn't forget this medic's face for years. And that's a definite benefit. There's definite gratification that you can take from something like that. Not everybody can do that. Not everybody can experience that. And that's important. That's one of the things that might keep you going. When we started this podcast, we wanted to talk a little bit about the challenges that EMTs and paramedics and everybody in EMS face. We also wanted to talk about some of the benefits. We wanted to encourage people coming into EMS. And we also wanted to give a little encouragement to anybody that's already in EMS. We wanted to help them continue, hopefully. Help them be safer. Help them be better out there. We hope to continue doing that in the next seasons. We wanted to take this moment and quickly introduce you to some of the EMS professionals that are working out there and let them tell you how long they've been working.
My name's Esteban Ibarra from Los Angeles, California, and I've been in EMS for about 3 years now.
Hey, I'm Daniela. I'm an EMT in Houston, Texas, and I've been in EMS for about 6 years now.
Hi, my name is Elson Diaz. I'm working in Philadelphia, Pennsylvania as a paramedic, and I've been in EMS for 10 years.
My name is Romeo. I've been in EMS for 19 years.
Hello, I'm Robert Reyna. I'm from Texas, and I've been in EMS for 38 years.
Remember the EMT from the interview at the beginning of the podcast? He's still in EMS.
Robert Umbris, South Texas. I have been in EMS for 11 years now.
We hope you've enjoyed this podcast. We hope you've gotten something out of it. As usual, if you have any questions, comments, concerns, feel free to let us know. You can send us an email, or you can find us on Tumblr or Twitter. We're going to be taking a little break. During the break, we are going to be working on the website. A few changes are going to be going up. We're also going to be adding a reference page to the website. We're hoping to start up season 2 sometime at the end of November. We hope you'll stay tuned and join us when we return. As always, stay safe out there. And remember, better life is our mission.